Hello, good afternoon to all. I welcome all of you to Trivandrum Institute of Palliative Science. And today we have echo sessions on PalliCovid ECHO. And the sessions will carry out by Dr. Biju Ravan sir. And today we have sessions on communication in context of COVID-19. And I have also Sun sir. Sun sir will give a brief discussion regarding this one.
Good afternoon. Today we have a very important topic which is very relevant in the times of COVID. We know that most of the people, the healthcare professionals who are treating COVID is using personal protective equipment. So there will be many barriers to communication, which we will hear more about from Dr. Biju Raghavan, who will be handling the session on communication. Dr. Biju has done his postgraduate diploma in pain and palliative medicine, and he has been working in palliative medicine for more than 15 years. Presently, he is working as the senior consultant and head of palliative medicine department of Rajagiri Hospital, Alva. And he has a special interest in medical communication sessions. Welcome, Biju, and it's over to you.
Thank you, Sunil. I hope I am audible.
Yes, you are audible.
So, thank you, Sunil. Thank you, Pallium India, ECHO. It's a pleasure to be here. And thank you, everybody who is joining in for today's session. As Sunil mentioned, I do have a special interest in communication skills. I've been taking conducting workshops for about 14 years now. And what I have found universally is that when people come in for those sessions, usually everybody is skeptical. At least most people are skeptical. And many of them come in because they have to, not because they want to, because they have enrolled in some kind of a course. Either it's a 1 month certificate course, or something like that. And so communication workshops become part of it. And I find there is usually a drastic change in people once they have finished the workshop. Then usually that's a time when people realize the importance. So it's quite a challenge to make professionals, healthcare professionals, interested in communication skills. One of the reasons could be that communication skills are not part of our regular medical education, medical training. So next slide. What I hope to do in this coming half an hour is to can you go back one slide, please? Overview and learning objectives. Yes, this one. So what I hope to achieve during this half an hour, 45 minutes is to talk about the importance of communication skills and hopefully make an impression about the need to learn communication skills. Please remember that this session is not going to equip us with the skills that we need, but it will give you an idea of what all are the areas that we need to look into. And in the context of COVID-19, which is the purpose of this webinar session, there are some unique barriers to communication, and we will talk about that. I'll also like to just briefly touch upon stages of grief and how we react to stressful news or stressful grief situations. And when we are stressed, one very common thing one very common emotion that we have to deal with is anger. Now, as healthcare professionals, we will have to deal with anger in our day-to-day, our professional life. And this is a little bit more acute when it comes to dealing with people who are scared, stressed out in the times of COVID. And then some generic do's and don'ts. And that is how I hope to finish today's program. And as Sunitha mentioned yesterday, there's a beautiful ebook that has been compiled by excellent group of people. I'm honored to be part of that. So, and it will give you a lot of information on various aspects of caring for people. And also for symptom control, it is advisable to download the PalliCare app. It will be very, very helpful. It will be an add-on into your armamentarium. So having said that, let us move on to the next slide. Healthcare communication uh, is generally challenging. Even in the best of times, it is challenging. And the reason for that is that people don't come to us because they want to come to us. They come because they have to, because they are ill, they are sick, they are in pain, they are struggling with medical problems. So unlike other situations like in the hospitality industry, where people go to a hotel or a resort because they want to, there the challenges are different. In our healthcare environment, people come to us already in a negative state of mind, and especially in an hyperacute situation like corona infections, where there is so much of uncertainty, where the symptoms might have suddenly worsened to severe agitation and breathlessness. It is all the more difficult, it is all the more challenging. It is also difficult because whether you have done a good job or not does not depend on you actually. It depends on how the patient and family perceive what you have done, whether you have been successful in good communication or not. So you may be very good and may be very knowledgeable in your area of expertise, but as far as communication is concerned, that lies in the eyes of the beholder, and in this case, it is the patient, the family, and society in general. So that is the big challenge that we face. Next slide. Also, we have to understand that it is important to learn good communication skills because a lot of medical errors happens because of that. Some studies say around 60 to 70% of medical errors occurs as a result of poor communication, and which are clearly completely preventable. And a lot of these medical errors not only harm the patients, but also indirectly harms us in form of litigation. And sometimes in many parts of the world, doctors and other healthcare providers are attacked physically because of these kind of errors. So it is very important to understand that communication skills is very, very important in patient safety as well as our own safety. Next slide. And it also has a financial outcome. There was this study which came out in Journal of Healthcare Management in 2010, Agarwal et al. And they found that this study was done in US, so it is in US dollars. $12.3 billion are lost out due to inefficient communication. Next slide. Now, all of this happens because while we were getting educated, our medical education system had a proper testing of our clinical competence. We used to write exams where our medical knowledge, the theoretical knowledge was, examined. We had to undergo clinical examination where our ability to do physical examination was checked. And when we used to have viva voce, we also were being checked about our problem solving skills. So all of these skills that goes into making a professional were being checked while we were getting educated. However, as far as communication skills were concerned, especially in resource poor countries, middle income countries, the communication skills were not really part of our normal medical education. Recently, the government has come up with this ruling that communication skills should be part of the our education training program. So for the future generation, there is things may be little easier. But the present problem is we don't have enough teachers to teach medical communication skills to our young budding doctors and nurses. And for rest of us, we never got an opportunity while we were studying to incorporate. We did not have this opportunity to learn communication skills while we were young budding doctors and other healthcare professionals. Next slide. So what we need to understand is when it comes to specifically doctor-patient relationship, effective communication has a multifaceted areas of effect. For example, diagnostic accuracy. We all know the best way to make a diagnosis is to get a good history. And to get a good history, effective communication is a must. And similarly, if your patient's compliance has to improve, they should cooperate with you. And to cooperate with you, they must know why you are advising them something that is so uncomfortable for them to swallow so many pills so many times a day, to keep track of the times, and those pills are not uh, good to taste either. It's a lot of problems. So, and many times it can be scary if they need to undergo a surgery. Many times people just don't comply with that advice just because they are scared. So a good communicator will understand these kind of things and will be able to answer the patient's queries, their concerns, and will help them come to a decision. As a result, the compliance will be better. And if the compliance is better, naturally the outcomes will be better, and you will have a better patient satisfaction. And if the patient is happy, we all are happy. Our team is also happy and satisfaction. So overall, there will be a positive atmosphere. And that is the effect of good communication, good and effective communication. And as I said earlier, patient safety is also paramount. It's of importance, paramount importance, and good communication goes a long way. In fact, major part of patient safety is about good communication. And if the patient is safe and the patient is happy and satisfied, your chances of getting sued and taken to court, the chances of litigation will also be much less. So all of these are win-win for everybody, not just for the patient and family, but for us also. So it is important to understand that we must learn communication skills for our own selfish interest. Next slide. So some more evidence. This came up in the journal, Headache Journal 1986. It is still valid. The best predictor for resolution of headache problems turned out to be the patient's perception that they had an opportunity to tell their story and discuss their concerns about the headache fully with their physician during the first visit. So it is again about communication, active listening. And once we are able to give patients satisfaction, it is natural you will also have their loyalty. So the client loyalty follows client satisfaction. And if you have a satisfied and loyal client, you will be safe, and it is the best interest of everybody. Next slide. However, as we know that even in the best of circumstances, communication is not easy. There are multiple barriers. I'm not going to go into barriers in general, but because this session is about communications in times of COVID, I'm confining myself, uh, focusing on barriers to communication in times of COVID. Next slide, please. Now, we are relying more and more on technology because we are forced to maintain social distance. Ideally, I would be talking to you in person. We will be sitting physically in one place. We will be traveling and coming to one place physically, and we will be talking face to face. But right now, that is not happening. You are all in your own places, and we are connected to each other through the network. And this technology enables us to have this interaction, this webinar. However, many of us, before all of this happened, were not very tech savvy. We had to learn this in a hurry. Also, it is important to remember that if the network was suddenly to go, this webinar will just crash. So technology is great, but please remember there'll be a lot of technological barriers. For example, does this place have enough proper telephone coverage? I instantly go on field trips. I provide home care for patients, and there are many places where I go where there is not enough proper telephone coverage. So if me or my staff have to communicate to each other, if we are in different places, many times we'll have to come out of the patient's home, come onto the road to get some kind of coverage. So that is true for many of our patients, and that must be true of many places in the world. Same thing would apply for internet network. And what about people who are technologically challenged? What about our vulnerable patients who may not be able to use these modern gadgets? What about the elderly who may find it very difficult to learn how to use this technology? So there are technological barriers in times of COVID. So when we think of communicating, please remember that we may come across this kind of barriers, and then we'll have to think of how we can still communicate, how we can circumvent these barriers. Sometimes we may be challenged, we may not have much of an option, but there is always some other way of reaching out to people. Next slide. Sometimes our patients may be a barrier. They may be so stressed out with anxiety or anger that it will be very difficult to communicate with them. Or they may have a pre-existing disease which affects communication normally, face to face. For example, if somebody had a stroke and has got aphasia, so how difficult it will be if we are fully covered up with an N95 mask and coveralls and all of that, and all we can't hear properly. So how are we going to have a communication with such a patient during this kind of a situation? So COVID-19 has created more barriers, uh, and during in the best of times there are barriers, but COVID-19 creates more barriers, and as a result, it is becoming more difficult to communicate. Some of the feedback that we have got of people who have had to don uh, this kind of coveralls was that it is very difficult to project your voice outside, and also sometimes very difficult to hear properly what the patients are saying. So it's very difficult to communicate even if you're physically nearby. Next slide. And in our society, many of you who are watching television or viewing videos on WhatsApp know that there is so much of stigma and fear about this illness, that many of our healthcare providers, doctors, and others have been abused because they are dealing with this infection. And there have been some unfortunate situations where one eminent doctor died with COVID infection, and many of you know that his cremation became a big problem. So all of this happens because many of our people are not well educated, so they are easily gullible, and even those who are educated, they're very poorly informed or misinformed. So it's very important that whether they are educated or not, we have to make an effort to give them proper information. It's the job of the government. It's job of everybody who has some authority to give proper information. And as healthcare providers, we do have the authority to convey the right information so that we can reduce this anxiety, this fear and stigma surrounding this infection. Next slide. As I said, just one slide on our reaction to grief. Elizabeth Kubler-Ross is famous on a study on thanatology. that is the signs of death and dying. And she came up with this 5-stage model. So this has been modified to suit our COVID epidemic. And I'm thankful to Dr. Jitin, who was our ECHO-2 participant, who sent me this slide. So I'm using it. So what it says is that whenever you're faced with stressful news, a bad news, our usual first reaction is to go into denial. This is not true. This is not affecting me. I don't have this. That kind of a reaction where we deny that this thing is happening to us. And the second stage is anger, and this anger can be directed towards the medical community, it can be directed towards the family, it can be directed towards God, it can be directed towards self. This essentially, this anger can be directed to anybody and everybody. This is the second stage of reaction to stressful situation, bad news. And then the third stage is where you bargain. I will give this, I will spend this much amount of money, or I'll take this person to America, but I need to get this thing sorted out. So this kind of bargaining goes on. And many of us may have experience where people come and says, Doctor, money is not a problem, do everything possible. So that is their reaction to stress, where they are trying to bargain with us. They are throwing money at us and hoping that we will be able to do. So some of us may have got irritated when people come and say like, or they may give drop in big names. I know this minister, I know that person, this person, etc., etc. Where they're just in this stressful phase where they are trying to bargain with us. Then the stages of depression, nothing is going to be right, everything is doom and gloom, I am not going to get better, all this kind of very 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 depressed situation is the fourth stage. And finally people come into this fifth stage of acceptance. That is, okay, this is what has happened, I am accepting this has happened, I am limited because of this, but now let me see what I can do with what I have. So this is generally considered the 5 stages. Now what you have to remember about this is that this may or may not happen in this linear fashion. People may go according to 1 2 3 4 5, or they may go from 1 to 5, then 5 to 3, 3 to 2, and 2 to 4. All of this thing could happen. Or they may start with 3, go to 4, go to 1, go to 5. So what I want you to all understand is that human beings may not follow this linear order. This linear order is for us to understand what the human psyche can be. So, if you understand that, and when you start talking to a person, the person sitting in front of you, you will be able to place this person in any of these stages. And if you understand what the stage this person is in, it will become easier for you to communicate with this person. Otherwise, it will become very, very frustrating. You just don't understand why this person is behaving this way. As I gave you one example, when people come and say, don't worry about the money, do everything possible, or I know this minister, or I know the CEO, or I know the MD of this hospital, he was my classmate, and things like that. So the people are in that state of bargaining because they are stressed, they are scared, so they want to hang on to something. So this is just to help you to understand, so that you don't get confused regarding the state of the person sitting in front of you. Once you understand that, then you will be able to communicate better. Next slide, please. So we talked about technology as barrier, we talked about patients as barriers, we talked about society as barriers. Now, can we be barrier? Remember, before COVID, before BC, we used to look like normal healthcare providers. Sometimes we used to wear a coat, sometimes we would not. We usually would put a stent around our neck, and that was our usual image. But now we are looking like this. Those who are actively providing care for infected patients, we are in full coverall. There is hardly any part of our body that can be seen. And otherwise, most of us are wearing at least a mask. Now, mask is mandatory not only in the hospital but outside also in many places in the country. But definitely in most hospitals, we are all walking around with mask. Now, what happens with this kind of covering up is that many of the important body language, the body cues, are now getting covered up. People can't see our smile. They can't see our facial expression. So all of our facial expression, which shows concern, which shows empathy, which shows friendliness, which shows happiness, all of these things are getting covered up. And because of that, in the special situation we are in, that is in times of COVID, the body language is becoming very, very difficult. There's a big barrier in communicating with our body language. And as a result, we are finding it difficult to express ourselves properly, right? So we need to find some solution to that. Next slide. So this is on the left side of your screen. This where doctors. This was a picture. This is an actual picture which was sent to me by my friend who works in US, and he just sent me this picture where nowadays some of these doctors are putting up their own picture. They had just taken out a print of the picture and then just laminated it and pasted on top of their coveralls, so that even if you can't see them their face, at least people will know what they look like. And plus in some places you have the special kind of masks. I don't know whether it's available in India, but this is made in USA, so I'm sure it is available there, where it provides all protection, but also a small strip of plastic is there, which also helps in showing a little bit of the face, especially the mouth, and where the smile can be easily seen. So these kind of options are there. In our case, we don't have this kind of mask, but at least we can think of the other solutions that is in front of you. And also, if you don't have uh, uh, this kind of option, please remember our voice, the quality of our voice has a value. You can bring the smile in your voice even if you can't show the smile on your face. Next slide. As I said, lot of this situation is leading to stress, and stress is breaking out in form of anger, much more than what was normally seen, especially where people are dealing with a lot of infection. The 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 human resources are getting saturated and other resources are getting scarce. This is leading to a lot of anxiety and panic, and many of these things are coming out as an anger. And we as healthcare professionals, we need to know how to deal with this anger, in especially in times of uh, corona. So anger is an high energy. Anger is a high energy consuming negative emotion. And please remember, nobody wakes up in the morning and decides to get angry today. Nobody decides like that. It is the multiple stresses that builds up over the day which leads to anger. So there are usually more than one reason why people get angry. There are multifactorial etiology. And as I said, this is primarily an expression of emotional stress. So what is to be done about it? Next slide. Whenever you're dealing with an angry person, we have to remember that we shall not ignore the anger and we shall not confront the anger. Both will increase the anger. Ignoring the anger increases it, and confronting the anger also increases it. So what do we need to do? We have to facilitate the anger to flow away. Just like you would do an ascitic tapping. You put in a needle and you allow the fluid to slowly flow out. Similarly, you deal with anger. You facilitate anger to flow out. And how do you do it? Remember, when people are very angry, there is so much of adrenaline that they cannot sit down. So when you see somebody who is angry, don't ask them to sit down. Instead, what you do, you and stand up and listen to them. If they are angry and you are sitting, then the anger may increase. If you're sitting and you ask them to sit down, then also the anger may increase, because that person just cannot sit down because there's so much of adrenaline. So it is futile to ask the person to sit down. And it is counterproductive because it will make the person even more angry. So whenever you confront somebody who is angry, you stand up and listen. Don't sit and listen. And while you're standing up, slightly bend your spine forward. That is the slight kyphosis. Not too much, not like that Air India Maharaja kind of kyphosis, just a slight bending forward of the spine. And this shows respect, that I respect you. At the same time, you make eye contact, and this shows confidence. So you confidently but respectfully stand and listen to this person. So you are neither confronting because you are respectful, you are neither ignoring because you are making eye contact, and you're standing. And the body language of standing and listening is always going to be more productive than sitting and listening. And if you make these three things, then that person's anger will flow down very fast. And once the severe anger is down, it has come to a slight sim kind of a situation. The anger is still there, but it is not an explosive anger now. Then ask the person, uh, then in fact tell the person that you want to know more about this problem. Can we sit down and discuss? That is the time to invite them to sit for this and allow them to ventilate. Let them speak more. The more they ventilate, the more they will become calm. Now, at the end of this, there may or may not be a solution to the problem. That is why this person got angry. There may or may not be a solution. If there is a solution, if there is something to be corrected, do it. And if it is not, if there is no solution, then
Viju,
listen to
Viju,
and yes, hello.
yeah, we lost you for a few seconds.
Okay, yeah. What I meant was, if there is anything to be corrected, once the tempers are down and the problem has been solved, then do correct it. Solution to the problem, just leave it like that. If it is appropriate, do apologize, but it is not necessary to apologize all the time. Only if it is appropriate. And what is appropriate will depend on the situation you are dealing. Now, when we are talking about anger, I want you to be very clear. This is the personal one-to-one anger situation that we are talking about. We are not talking about a big mob coming and trying to attack us, because a mob psychology is very different from an individual person psychology. If it is a mob, an angry mob which is attacking us, then definitely you have to take care of yourself. You have to move away somewhere which is safe and let the law and law enforcement do its job.
Viju, we lost you.
Can you hear?
Yeah,
Can you hear me?
now it's okay.
Okay. All right. So, so if you are dealing with somebody who is under the influence of alcohol or other substances, there also this method is not going to help, because that person is under the influence. That person is not open to reasoning. So this is the situation. This is the technique that you can deal with people who are sane, and on a one-to-one person basis, this will help. This is how we deal with angry situation in our professional life on a daily basis. So next slide. Along with dealing with other people's anger, we have to deal with our anger also. Remember, we are also very, very stressed. And as a result, our stress may also come out as anger. We don't get up in the morning planning to get angry, but over a period of time, our stress may make us get angry. And once you express anger on somebody, you can't take back your words. It is very important to have some kind of a self control. And for that,
Vijay, Vijay,
hello, yes,
yeah, we
hello,
lost you.
hello,
Now we can hear you.
okay, right. So, what I was saying was, it's very important to take good care of yourself, and self care is very important. I have dedicated one slide to self care, which is coming later. And it's also important to arrange a spotter. The spotter could be a colleague, or it could be a friend or a family member. In our professional life, it is always important to have a colleague, because your family may or may not be there who is working with you. So it could be a colleague and a friend. And the role of the spotter is to give you an honest opinion and an honest information that your voice is getting louder, your tone is getting very, very harsh, or your words are getting very sarcastic, you are slowly getting angry. So all of this feedback is important so that you realize, and as a result, you're able to control yourself. So it is, and similarly, you can be a spotter to your colleague also. So this is one way you can take care of yourself during your professional life in times of COVID. Now I'll go to some of the do's and don'ts. Can we have the next slide, please? Okay. Some of this body language which I was talking about. So anyway, you're wearing a mask. The only thing that is visible is eyes. So please don't avoid eye contact. And what is face is not visible, but your voice is visible. Your voice is heard. So don't have a grumpy or stern voice. So please have a pleasant face behind the mask, so that the voice that comes out is also pleasant. Smile behind the mask also. Just because you're wearing a mask does not mean you don't have to smile. Please smile. A little bit of that smile will show in your eyes also, and definitely it will show in your voice. So you can smile with your voice, and also you can say some of your emotion. For example, you can't show it in your face, but you can say, oh, this makes me sad, or oh, if you're if you got some information and you're concerned, so you can say, oh, I am concerned about this, or you can say, oh, I'm happy about this. So verbalize your emotion, because your actual emotion, your face, cannot be seen by your patients or the family members. So verbalize your emotion. Next slide. Don't categorize or label people. Some of the examples are there. She's a very difficult patient. In times of corona, we have had people we have been categorizing as super spreader. Remember, when you get a label like that, how difficult it becomes for you to survive in this situation.
Vijay, again we lost you.
People start pointing fingers at you. Hello, can you hear me?
Yes, sir.
Hello,
Now,
can you hear me?
yes, now we can hear you.
Okay, right. So it is very important to be non-judgmental, accept people as they are, and respect people for for what they are. So please don't label people as super spreader or difficult patient, or for that matter, COVID patient. It is just an infection, and we get infection all the time. So if at all we have to say the corona infection, patient with the corona infection, we don't label people as COVID patient. Next slide, please. Now, when we talk to people, many of us use a leading question. Your cough is better now, isn't it? Your pain is better now, isn't it? So when you ask that question, question like that, many a times people find it very difficult to say no. And they may shake their head. And it's very important to ask an open-ended question. How are you now? How is your cough now? So you'll get a correct picture. You'll get the correct answer. Next slide, please. Do not minimize people's problem. You may be, uh, you know, a person who has been in the healthcare industry for a long time. You may be facing
Viju,
problems, and yes.
I'm lost for a few seconds. Unable to hear you.
Hello. I not do self. I'm not doing much actually. Hello, can you hear me?
Yes, sir.
Now,
Hello. Okay. So shall I proceed?
yeah, please.
Okay. So do not minimize patients' problems. For them, their problem is the biggest problem in the healthcare industry.
Viju, is that the problem with the net or with the microphone?
The biggest problem.
Viju,
Hello.
Viju, we didn't hear
Yes.
you. Yeah. Is that the problem with the net connection or with the microphone? We are unable
Okay.
to.
Not change my. I have not changed my position of the microphone or myself.
Voice is breaking now. Please continue.
Oh,
No, we are unable to hear you.
okay. Hello.
Ah,
Yes.
hello.
Hello.
Ah, Viju.
Hello.
Yes.
Hello. Oh,
Continue.
can
No?
you hear me now?
Yeah, now it's okay.
Possible. So don't minimize patients' problems.
Viju, no. We are unable to hear you.
Not helpful. Instead, what is acknowledge that they are in a difficult situation, acknowledge their emotions, and give them permission to feel normal with their emotion. So some of the examples are anybody in your position would perhaps feel this way. Another example is how do you normalize? Do not normalize their problem, normalize their emotion attached to that problem. Next slide. Okay. And sometimes you are going to see very serious situations, but please don't give false hopes. Just don't tell them everything will be fine. And what is to be done is to give realistic hope. Now, this is where palliative care really scores, because in our other medical practices, the disease focused medical practices, there is always a limit to what we can do. There may be no limit to diagnosis, but there is definitely a limit to how much you can cure or how much you can control. But in palliative care, there is no limit to the amount of comfort care you can provide. And hence, it is a good idea for all doctors to learn the principles and practices of palliative medicine, because you will never have to say, oh, I don't have anything more to offer. Because in palliative medicine, we say that there is always something to be done. And that is a realistic hope we can give to people. For example, your disease may be end stage, but still I can keep you comfortable. In fact, before coming to this, taking this session, I was actually taking care of the pain of a person with an advanced malignancy. And the only thing that they were saying is
Lost you, Biju.
disease is advanced or not. The only thing that they are worried about is that this person is in so much of pain. So once the pain is taken care of, the relief is immense. So there is always something to be done realistically. And in times of COVID, during this session, yesterday Sunitha took the session on breathlessness and agitation. Please remember, there is always something to be done. But don't give false hopes. Do not assume. Many times we think that people are worried about COVID and we give them all kinds of information about COVID, but it may not be necessary about the disease that the people are worried about. They may be worried about the family situation, their financial situations, about the children's education, about children's marriage, about their job, loss of income. How are they going to pay the EMIs? There can be so many things that the people can be worried about. So do not assume. Ask them what they're worried about. You ask them, and you will get an idea what they're worried about. They will tell you. And many a times you will just have to listen because you may not have a solution to offer. As doctors, we are very good at offering solutions, medical solutions. But remember, people are not just patients, they are people. They have a family, they have a job, they have a life outside of the medical world that we live in. And there can be a lot of worries that they have regarding their life that we are not aware of and something that we can't do much about. So do not assume and don't give just reassurance. Ask what is the problem, listen to them. Active listening is therapeutic. Definitely provide active listening. Next slide. Next slide.
Biju, 1 minute.
Yes. Go back. Yeah. Next slide. So whether you are wearing a mask or you are wearing a full coverall, doesn't matter. You can still touch your patients. And if you're outside of your patient care area, you can touch the family members. So the human touch is very, very important because that conveys a lot. It conveys understanding, it conveys empathy, it really comforts. So it is very
Please, we go
important.
from another place.
Hello? Hello?
Yeah, Biju, please continue.
Yeah. And it is also important to do regular briefing. This is Pinarayi Vijayan, our Chief Minister of Kerala. He is famous for handling crisis. Uh, Last year it was the floods. Before that it was the Nipah virus infection, and this time it is the coronavirus infection. And he conducts regular press briefing, and he gives all information. That the important thing is you have to be honest and you have to be on time. So you give honest and transparent information in real time. So that is the Kerala model of dealing with it. And that is why people believe the government and people cooperate with it. Similarly, if we are honest with our patients and their families and we give them real time information, tell them information as and when it happens. It's not necessary that one person, has to do it. It's a team game. Communication is a team effort. So whoever is available should convey the information honestly, transparently, and in real time. If somebody is deteriorating, give that information to the family somebody is deteriorating, and in real time, so that people know what is happening, and then they will believe you. They will, yeah, of course, it's a hyper acute situation. Things move very fast. Sometimes you may have a lag in the information you are giving, but as much as possible, give it in real time. Be honest, be empathetic, and give it in real time. Next slide, please. Yeah, this is the slide I was talking about. This is, I think, one of the last slides. You are taking care of other people, and it is natural that you will feel stressed out. Many people do get burnt out. I'm sure that one of the sessions during this week will be about taking care of yourself, how and others in burnout. So I'm not going there, but please remember, do practice self-care. And one of the most important part of practicing self-care is to have a routine. If whether you are in quarantine or you are on active duty, doesn't matter. Every day you get up, get fresh, have a routine, whether you are going out or not. And it's very important to do some amount of physical exercise and some amount of mental exercise that we call meditation. So keep yourself physically and mentally well toned as much as possible. Indulge in some hobbies. It could be as simple as 110-year-old lady, which I saw in WhatsApp, that she's so old, she can't go around doing many things, but she has a hobby of gardening. And because she's so old, she can't go out. So she has one table and kept some plants on it, and she waters it every day. So that taking care of somebody, something, indulging in some hobbies is very, very important. It is rewarding. So do indulge in some hobbies. Whatever little time you have, indulge in some hobbies. And also, last but not the least, stay connected. Stay connected to your loved ones. Meet new people with all this technology around us, and uh, take good care of yourself. So I think that is about this thing.
Okay, thank
And
you.
next slide. Next slide. So there are further resources and training materials for you. This is uniform with all the presentation. Next slide. Yeah, go on. And please do download the ebook. And these are the contributors for the ebook. Very honored to be part of this group. Next slide. Thank you. And at the end of the session, please stay back for your feedback. Feedback will help us improve our services to you. Thank you. Over to you, Sunil.
Thank you, Biju. So, even though there were some interruptions, maybe due to poor net connections, I encourage the participants to ask questions or comments. Dr. Navjeevan Singh.
Thank you, Biju, for that very engaging session.
Thank you, sir.
There are two good reasons. You covered a lot of ground that I myself am familiar with and work in. I have been a professor of pathology, but in the last 8 to 10 years of my career, before I retired, I developed an interest in theater.
Uh-huh.
Theater is all about communication.
Yes, yes.
And we have been using theater techniques in training doctors and other medical professionals to communicate.
Oh,
We've come
wonderful,
up with
sir.
a very simple paradigm. We call it the ABCDE paradigm.
Uh-huh.
And the A is for attitudes and B is for behavior. C is for communication. D is for respect for diversity. E is for empathy with ethics. As you can see, the C is the fulcrum. Communication is the fulcrum of all this, and it is mostly affected by our own attitudes and the way we behave. I'm
Very
glad you
true, very
covered
true.
it in a different way. It gave me a fresh perspective on the whole thing. In summary, if I've understood what you said correctly, what really matters is our listening skills.
Absolutely, sir.
If we are able to ask instead of tell, and if we are able to listen instead of speak, a lot of problems would diminish. Moreover, you talked a lot about how the face cannot be seen and therefore communication becomes difficult. Theater also trains you to speak through your body, not
Yes.
just the face. As a matter of fact, there are several exercises in which you cover the face and express yourself through your body without the face being visible. Um, I hope someday these will find favor with people like us who wish to teach and talk about communication. It was wonderful listening to you. Thank you.
Thank you, sir. Thank you so much for your comments. And I'm so glad to hear that theater is now being used to train medical professionals. I would love to be part of it and learn some of it myself if possible. And regarding the A, B, C, D, E, the C seems to be the center of everything that
It's
you
the
said.
fulcrum.
Yes,
Fulcrum that balances everything.
yes, indeed it
Uh,
is. Thank you so
part,
much, sir.
part of the reason that medical humanities and the ABCD paradigm is now included in the MCI, new MCI curriculum is because our
Yes.
group advocated for it.
Oh, thank you so much for that, sir. Thank you so much.
Thank you
Generations
very
of
much.
doctors will uh, be benefited out of that.
I hope so.
Thank you. And great to meet you, sir. It's an honor.
So Dr. Rajani says she loved the point about smiling behind the mask. It is important to internalize the kindness and empathy and express in everything.
Thank you for noting that.
Anybody else? Any comments or questions? Anybody? Dr. Ketki asked, can we walk away from the situation when we are angry?
I would like to ask the participants uh, how they feel about that. If we are engaged in patient care and a situation makes us angry, uh, would walking away help the situation?
Anybody want to give their opinion? No response.
Okay, I guess there is no absolute yes or no answer to that. I guess it will vary from situation to situation. It also will depend on how skilled one is in dealing with our own emotions. The more skilled you are, the less likely you will need to walk away, actually. That is why I suggested having a spotter. It could be a friend, colleague, who could you could ask the person. It could be somebody who is likely to be around you during your working hours, or it could be more than one person. Just point out whether you're getting angry or not. However, if nobody's around and you are feeling very frustrated, very angry, and you think that there's a possibility you may explode in anger, and that can definitely make the matters worse. So maybe depending on the situation, if you could, if it doesn't harm the work you are doing, if you could just walk away, go to the bathroom, splash some water on your face, and maybe look in the mirror and try to smile at yourself, because smiling at yourself creates a positive energy. And even if you have to force it, when you're angry, it is not easy to smile. So but if you just, for this heck of it, just look in the mirror and force a smile, there's a possibility that you may calm down a little bit, enough to go back into your stressful situation and start working again. I guess it will depend on situation to situation. It will depend on person to person and how they are best able to cope up with um, the situation. I know it is not a, probably it is not a very satisfactory answer to it, but I'm open to suggestions if anybody can uh, would like to make any. Okay, Dr. Ketki Patek says this will help. uh,
Dr.
Thank you
Rajni,
for being of some service, Dr. Ketki.
Dr. Rajni has another comment. There have been
Yes.
suggestions for using transparent cutout, handmade mask for hearing impaired patients so they can lip read. This is obviously not for people in close contact with patients less than 1 meter. That is a mask with a fabric cutout in the mouth area, replaced with a plastic sheet fused.
Yes, yes, agree. Because in close contact, your health is at stake. So there are other ways of communicating. If the person can read, if the person is literate, can read, then we can write on a board, and you can carry around a board and write it on it, or you can ask the person to write it on a piece of paper. You could give a pen and piece of paper, and if not, maybe we can have pictures, descriptive ways of communicating. It's not necessary that we have to resort to lip reading all the time, especially if your health is at stake. That would not be advisable, but otherwise I guess it should be okay.
Dr. Navjeen Singh has given an article which you can download. It is given in the chat.
Thank you, sir. We'll definitely, I'll definitely go through it, and hopefully take points from it so that I can incorporate it in my presentation for future echo groups.
Oh,
Thank you
you are
so much, sir.
welcome. This is our journal on the medical humanities, which we are running from here.
Uh-huh. Thank you, sir.
Okay. Are there any more comments or questions? Uh, so I think there are no more questions or comments. So thank you, Bijo, for this wonderful session, and you have given some clues about how to communicate with patients having COVID in this difficult time. So it's a challenge that we have to face, and with some clues, we can communicate better to the patients. And you have also talked about some general situation which we have to handle sometime. Thank you. And thank you all for your active participation. And before you leave, please fill in this feedback questionnaire.
Thank you, Sunil, and thank you everybody for listening and participation.
So tomorrow we have a session on ethical issues, goals of care, and triage in the context of COVID-19 by Dr. Moira Ling at 3 p.m.
Sunil, with your permission, I would like to leave. Is that okay?
Yeah, please.
Okay. Good day, everybody. Thank you for logging in.